Alright guys, so today we're going to be talking about the temporal bone, which is question 15 from section A. Okay. Now guys, the temporal bone is probably one of the most complicated bones in the cranium, or the most complicated bone in the cranium, but because I have studied this bone inside and out for a very long time, I guarantee you guys that if you master this video, you should have no problem in the oral examination or any oral examination of the temporal bone. Okay. Now the temporal bone, first off, is a paired bone, and it's on the lateralmost part of the cranium, as you can see. Okay. Now the temporal bone has many different functions. Okay. One function is that it holds the internal ear. The second function is that it gives off muscles and ligaments. Okay. The third function is that it forms different structures such as the zygomatic arch. And the fourth function is that it has numerous foramina and canals passing through it. Okay. And these numerous foramina or temporal canals passing through it serve as passageways for communication for different areas of the skull. Okay. Now, next we're going to discuss that the temporal bone has 4 parts to it. Okay. Now, before we begin discussing those 4 parts, first you have to acknowledge the fact that we have a ring here. Okay, and this ring is going to be known as the bony external acoustic meatus. Okay, and we're going to use this ring to orient ourselves with the 4 parts of the temporal bone. Okay, now for the sake of the video, we're just going to refer to this as the bony external acoustic meatus. Okay, above the external acoustic meatus, okay, we have the squamous part. Okay, postero-inferiorly to the bony external acoustic meatus, you have the mastoid part. Okay, now composing the majority of the wall of this bony external acoustic meatus, encircling it, you're going to have the tympanic part. Okay, now one might be asking, well, we've just discussed 3, but you said there were 4 parts. Now there are 4 parts. The 4th part can be seen on the internal cranial base or the external cranial base. So we're going to have to use a different illustration. So let's go to page 11 of the Netter's Atlas. And right here, okay, if I take my pencil, okay, and if I take my pencil, okay, and I line it up this way, that's going to be your petrous part, or your 4th part of the temporal bone. Okay. Now, this right here, just for reference, is the squamous part. Okay. And this right here is going to be your petrous part of the temporal bone. And real quick, before we begin discussing the 4 parts in detail, first off, I want to mention the fact that you see this temporal bone right here. It has a pink color, and surrounding the temporal bone, you have 3 different colors. You have yellow, green, and purple. Okay. Now, this is just for illustration purposes. But these colors basically represent the bones that surround the temporal bone. So the temporal bone, when it's inserted into the cranium, is going to be bordered anteriorly by the sphenoid, superiorly by the parietal, and posteriorly by the occipital. Okay. Now we're going to begin discussing each part in detail. The first part we're going to discuss is going to be the petrous part of the temporal bone. Okay. So I'm going to take my pencil once again. Okay. And I'm going to lay it like this, and when I do that, you guys can see a triangle. Okay, and this triangle is going to be known as a pyramid. Okay, so guys, when you think of the petrous part of the temporal bone, automatically you're going to think of a pyramid. Okay, because this triangle is meant to represent a pyramid, and this pyramid is going to have 5 different surfaces. Okay. And the 5 different surfaces that it's going to have, first of all, you're going to have your anterior surface, you're going to have your posterior surface, you're going to have your superior surface, you're going to have your inferior surface, and then the last surface is going to be your ventrobasal surface. Okay? Now, we're really only going to be discussing 3 surfaces because 2 of them really don't have much to say. Okay, so first of all, let's begin discussing your first surface of the pyramid. Okay, first off, this area right here is going to be the anterior surface, okay? And the anterior surface is going to have the apex of the pyramid. And at the apex of the pyramid, let me get a closer view. Okay, right here. Let me just, okay. So at the apex of the pyramid, you're going to have a depression for the trigeminal ganglion. And that's going to be known as your Meckel's cave. Anteriorly to that, you're going to have your carotid canal, okay, which is going to be this dark hole right here. And this carotid canal is going to give passageway for the internal carotid artery and the internal carotid artery plexus, okay. Laterally to these structures, or laterally to the apex of the pyramid, you're going to have two sulci, okay. One is going to be for the greater nerve, and is going to run from the foramen lacerum to the hiatus for the greater nerve. The second sulcus is going to be for the lesser nerve, and the sulcus for the lesser nerve is going to run from the foramen ovale all the way to the hiatus for the lesser nerve. Okay, laterally to the sulci, you're going to have an eminence. Okay, and this eminence is going to be anterior, and it's going to be in the midline in relation with the dotted line. Okay, this dotted line right here we're going to discuss in a little bit. But as of right now, you just have to know that it's anteromedial to it, okay? And this eminence is called the arcuate eminence, okay? I've shaded it here. And this eminence is going to be produced by the anterior semicircular canal. So let's go to the Themes Atlas to view a better illustration of the arcuate eminence, number 3. That's going to be your arcuate eminence. As you can see, there's an indentation from underneath, and that'll be produced by the anterior semicircular canal. And the last thing on the anterior surface is going to be more laterally to it, but you really can't see it because you're viewing it from a medial view. You're viewing the temporal bone from a medial view, so you can't really see what's lateral to number 3. So let's go to a superior view of the temporal bone, and as you can see, we have our arcuate eminence, number 3, and laterally to it, you're going to have a thin plate, number 2. This thin plate is going to be the roof of the tympanic cavity, okay? And this roof is going to be called the tegmen tympani, okay? Now that's going to conclude your anterior surface, okay? Now we're going to look at the posterior surface of the temporal bone. So now behind the dotted line, or posterior to the dotted line, you're going to have your posterior surface, okay? And we're going to use the Themes Atlas to talk about the posterior surface of the pyramid, okay? Now the posterior surface of the pyramid, okay, we have this hole right here, okay? And we're going to start from medial to lateral margin, okay? Medially, on the posterior surface, you're going to have this opening for the internal acoustic meatus. And this opening is going to be the passageway for cranial nerves 7 through 8, and also you're going to have the labyrinthine artery passing through here, okay? Posterior to the opening for the internal acoustic meatus, you're going to have this fossa, number 14. And this fossa is going to be called your subarcuate fossa. It's going to be created by the impression of the fetal flocculus, which is a structure of the cerebellum, okay? And posteriorly located to the subarcuate fossa, you're going to have another opening. And this opening is going to be for the vestibular aqueduct, okay? The vestibular aqueduct, its purpose is to connect the membranous labyrinth to the subarachnoid skull space, okay? And passing through this vestibular aqueduct, you're going to have the endolymphatic duct from the endolymph of the inner ear, okay? Now we're going to reference back the subarcuate fossa. We're going to reference the subarcuate fossa again, and we're going to discuss two things that are located below the subarcuate fossa. The first thing is directly below it, okay? Directly below it, and we're going to look at the inferior surface of the pyramid real quick, because it's not technically considered the inferior surface, but if you can see this hole right here, that's going to be your cochlear canal, number 23. And your cochlear canal, its function is to connect the osseous labyrinth to the subarachnoid skull space, okay? And passing through this hole or canal is going to be your cochlear duct, okay? Now remember, the cochlear duct, although it can be seen on the inferior surface of the pyramid, which we're going to discuss in a bit, it's not considered part of the inferior surface, okay? Now, let's go back to the subarcuate fossa, number 14. The other thing which is going to be located below the subarcuate fossa, but it's going to be more posteromedian. Okay, number 19. That's going to be your jugular notch. Okay, number 19 is going to be the jugular notch of the temporal bone. And this jugular notch is going to articulate with the jugular notch of the occipital bone in order to form the jugular foramen. So real quick, I'm going to look at the Netter's Atlas to show you. It's going to make a lot more sense in this picture. So you see purple, that's going to be your occipital bone, and that's going to hold the jugular notch for the jugular foramen. Okay, and anteriorly, having the anterior margin of the jugular notch or the jugular foramen is going to be the jugular notch of the temporal bone. So the jugular notch of the temporal bone and the jugular notch of the occipital bone are going to create the jugular foramen. And the jugular foramen is important because cranial nerves 9 through 11 are going to pass through it. And draining into the jugular foramen, you're going to have your inferior petrosal sinus, but most importantly, your sigmoid sinus. Okay? And the sigmoid sinus is going to give rise to the internal jugular vein on the external cranial base via the jugular fossa. Okay, so now we've finished discussing our posterior surface. Okay, we're going to real quickly now reveal what this dotted line is. This dotted line is the superior surface. Okay, and the superior surface is going to hold a sulcus for the superior petrosal sinus. Okay, so the superior surface is going to hold the superior petrosal sinus. But the main function of the superior surface is going to divide the anterior from the posterior sides of the pyramid. Okay. Now we're going to discuss the inferior surface of the pyramid. Okay. The inferior surface of the pyramid, first off, we're going to discuss with this big, large depression. Okay, number 21. That number 21 is going to be your jugular fossa. Okay. Arising from your jugular fossa is going to be the internal jugular vein. Okay, and the sigmoid sinus is going to drain into it. Okay, now the jugular fossa has a tiny canal in it. Okay, and that's going to be called your mastoid canal, number 24. Entering the mastoid canal is going to be the auricular branch of the vagus nerve. Okay, and the auricular branch in the vagus nerve is going to travel through the mastoid canal and is going to exit at the tympanomastoid fissure. Okay, which is going to be number 34. And it's going to exit at this fissure and is going to innervate the external acoustic meatus. Okay. Now, anteriorly to the jugular fossa, you're going to have this hole, which you've already discussed, and that's going to be your carotid canal. The carotid canal is going to be passageway for the internal carotid artery and the internal carotid artery plexus. Okay. Now, pay very close attention. I may have to refocus this. Okay, let's try again. Okay, now, if you look at this hole right here, in between the jugular fossa and the carotid canal, you're going to have a little hole right here, and that's going to be known as your fossula petrosa. Okay, and the fossula petrosa is a depression for the tympanic ganglion of the glossopharyngeal nerve. Okay, and this ganglion, specifically the inferior ganglion of the glossopharyngeal nerve, is going to send out the tympanic nerve to this hole right here, number 28. The tympanic nerve is going to enter the tympanic canal. Okay, and tympanic canal is going to be number 28. And when the tympanic nerve passes through the tympanic canal, it's going to go to the tympanic cavity and then the tympanic plexus in the tympanic cavity. Okay, so we've just discussed the jugular fossa, the mastoid canal, the fossula petrosa, the tympanic canal, and the carotid canal. And now we're going to discuss this process. Okay, number 26. This process is going to continue antero-inferiorly, okay, and is going to be responsible for being the origin of 3 muscles and 2 ligaments. The 3 muscles are the stylopharyngeus, the stylohyoid, and the styloglossus. And the 2 ligaments are the stylohyoid and the stylomandibular. Okay, so the styloid process is going to serve as the origin for these 3 muscles and these 2 ligaments, and posteriorly located to the styloid process, you're going to have 27. Okay, and 27 is going to be your stylomastoid foramen. The stylomastoid foramen is important because it's going to be the exit of the facial canal, and through the stylomastoid foramen, the facial nerve is going to come out and give its remaining branches. Okay? Passing through the stylomastoid foramen, you're going to have these stylomastoid vessels. Okay? Alright, so now we've finished discussing the inferior surface, or the inferior surface of the pyramid. Okay? Our last surface that we have to discuss is the ventrobasal surface. Okay? The ventrobasal surface is going to be the base of the pyramid. Okay? However, it can only be visualized when you've removed the tympanic part of the temporal bone. Okay? And because we can't do that, we can't really visualize the ventrobasal surface. Okay? Now we're going to discuss the squamous part of the temporal bone, because we've just finished discussing the pubis part of the temporal bone. Now we're going to finish discussing we're going to begin discussing the squamous part of the temporal bone. Okay? The squamous part of the temporal bone consists of a process that continues anteriorly, number 16, and that's going to be your zygomatic process. Okay? Number 16. Your zygomatic process is going to articulate with the temporal process of the zygomatic bone, and it's going to create the zygomatic arch. Okay? Now, following the posterior elongation of the zygomatic process, you're going to find the supramastoid crest, number 17. The supramastoid crest will continue on to the parietal bone as the inferior temporal line, and the inferior temporal line serves as the attachment, the high attachment for the temporal fascia. Okay? Now, below the zygomatic process, you're going to have a fossa right here, known as your mandibular fossa. This mandibular fossa is going to be used to articulate with the head of the mandible, and an anterior projection to this fossa is going to be known as the anterior tubercle. Okay? Now, as we've discussed earlier, this is going to be the bony opening for the external acoustic meatus. Above that, you're going to have a suprameatal spine, number 19. Okay? The suprameatal spine is going to give attachment to the cartilaginous external acoustic meatus. Okay? Now, that's going to conclude our squamous part of the temporal bone. Now we're going to use the Netter's Atlas to discuss our mastoid part of the temporal bone. Okay? Now, the mastoid part of the temporal bone, which is right here, okay, there is one fissure and two sutures that we're going to discuss that are related to the mastoid part of the temporal bone. The first fissure is going to separate the mastoid part of the temporal bone from the tympanic part of the temporal bone, and that's going to be known as your tympanomastoid fissure. And as we've already discussed, the tympanomastoid fissure is where the auricular branch of the vagus exits from the mastoid canal, and it exits from the mastoid canal, and it goes through the tympanomastoid fissure to reach the external acoustic meatus in order to innervate it. Okay? Now, this suture right here that I'm pointing to, that's related to embryogenic development, because after childhood, it's going to connect the mastoid part to the squamous part of the temporal bone, and that suture is going to be known as the mastoid squamous suture. Okay? The second suture we're going to discuss is the suture which connects the occipital bone to the mastoid part of the temporal bone, and that's going to be known as your occipitomastoid suture. And the occipitomastoid suture is the continuation of the lambdoidal suture, which connects the occipital bone to the parietal bone. Okay? Now, let's real quick use another diagram to see the occipitomastoid suture. Okay? This right here is going to be your occipitomastoid suture. And continuing or along the occipitomastoid suture, you have a foramen. That's going to be known as your mastoid foramen. Your mastoid foramen is the passageway for the mastoid emissary vein, which travels from the venous sinus, okay? And also it's going to be the passageway or the external exit of the posterior meningeal artery, okay? Now let's go back to the, let's go back and look at the mastoid part of the temporal bone. And now we're going to discuss the most important part of the mastoid part of the temporal bone. The most important part of the mastoid part of the temporal bone is going to be your mastoid process, which is this rounded elevation right here. The mastoid process, first of all, is going to be the insertion for the sternocleidomastoid. Okay, so the mastoid process is going to be the insertion for the sternocleidomastoid. You have to know that the mastoid process is going to develop after birth. Okay, and in childhood, it's going to develop these air-filled cavities. Okay, and these air-filled cavities are going to be divided by osseous septa, and these air-filled cavities are going to be known as your mastoid air cells. Okay, and if you guys remember from neuroanatomy, the mastoid antrum is going to communicate posteriorly with the mastoid air cells. Okay, and the mastoid antrum, just for your own knowledge, the mastoid antrum is going to communicate anteriorly with the epitympanic recess of the middle ear. Okay, the epitympanic recess of the middle ear is basically the superior margin of the middle ear. Okay, and the way the mastoid antrum communicates with the epitympanic recess is going to be through the adductus to mastoid antrum. Otherwise, another way of saying that is the mastoid antrum communicates with the epitympanic recess via the entrance to the mastoid antrum. Okay. Now, because the mastoid process right here has mastoid air cells, it's going to be considered a pneumatic bone. Okay, because skeletal pneumaticity defines a bone skeletal pneumaticity defines a bone having air-filled cavities as a pneumatic bone. Okay, and an example of an air-filled cavity in the cranium, beside the mastoid air cells, you have the sphenoidal sinus. Okay, the sphenoidal sinus is another example of a air-filled cavity, and the sphenoid bone is going to be a pneumatic bone because it holds that sinus. Okay. Now we've discussed the mastoid air cells. We've discussed the fact that it's a pneumatic bone. Now let's look at two grooves that are located beneath the mastoid process. Okay. Now we're going to use the Themes Atlas to look at these two grooves. Okay. First off, we have to mention the fact that there's going to be a deep groove and a shallow groove. Okay. The deep groove is going to be right under the mastoid process. Therefore, it's going to be known as the mastoid notch. Okay. This mastoid notch is going to serve as the origin for the posterior belly of digastric muscle. Okay. Now, medially to the deep groove, we're going to have the shallow groove. And the shallow groove is simply going to be a groove for the occipital artery. Okay. Now, we've discussed the mastoid process pretty well, and I think that's going to conclude the mastoid part of the temporal bone. Now we're going to look at the tympanic part of the temporal bone and finish discussing this temporal bone. Okay, so first off, remember that we have the bony external acoustic meatus. Okay, and the tympanic part of the temporal bone is going to make up the wall, or the majority of the wall, of the bony external acoustic meatus, except the posterior and superior margin. Okay, you guys have to note that the tympanic part of the temporal bone is going to be separated from the putrid part of the temporal bone by two fissures. Okay, the first fissure can be visualized laterally, which is 31. That's going to be your petrotympanic fissure. Passing through the petrotympanic fissure, you're going to have the chordae tympani passing through in order to meet the lingual nerve. Okay, the second fissure cannot be viewed laterally. Okay, so we're going to have to view the inferior surface of the pyramid. Okay, and number 31, 32 are your two fissures. More medially, you're going to have your petrotympanic, and laterally, you're going to have your petrosquamous, which I've shaded in. Okay, and these two fissures divide or separate the tympanic part of the temporal bone from the putrid part of the temporal bone. Okay. Now we're going to look at the tympanic part of the temporal bone in a bit more detail. First of all, you have to mention the fact that the tympanic part of the temporal bone helps close the tympanic cavity. Okay, and the tympanic part of the temporal bone has a dorsal lamella and a frontal lamella which unite inferiorly. Okay, And at the superior margin, or the superior or the cranial margin of the tympanic part of the temporal bone, you're going to have a tympanic notch. And this tympanic notch is left open in infants, however, later in life is going to be filled by the squamous part of the temporal bone. Okay? Medially to the tympanic part of the temporal bone, you're going to have the tympanic sulcus, number 7. Okay? And the tympanic sulcus is going to give off attachment to the tympanic membrane. Okay? So once again, I just want to real quick, I don't know if I mentioned this, number 8, that's going to be your tympanic notch, which is the superior or cranial margin of the tympanic part of the temporal bone. Okay? And guys, that's going to be your temporal bone. That's going to conclude your tympanic part, and it's going to conclude your entire temporal bone. We've just finished discussing every part of the temporal bone. We've finished discussing the pubis part, we've discussed the mastoid part, we've discussed the tympanic part, and we've discussed the squamous part, okay? And that's going to conclude your temporal bone.